Body contouring is changing or remodeling fat on your body. It is definitely unique to the individual. So when someone comes in, we're able to do a complimentary consultation. I do an exam, and then we determine based off of the patient's needs, their long-term goals, what is an appropriate treatment. We have several different body contouring treatments, some that are completely non-invasive and essentially painless. And then we have more invasive methods, our Body Tight from InMode, which is a surgical procedure where we do a body contouring with a radiofrequency wand and then follow it with liposuction. And that is all under local anesthesia. The most common areas we see for body contouring are definitely abdomen, routinely lower abdomen, upper abdomen, lower abdomen flanks. We also see women, a lot of them are complaining about their bat wings or the fat on their arms. We do often see the inner and outer thighs, but abdomen is definitely the most common complaint. I would say it's kind of split. Everyone has different goals. So some patients, they are definitely opposed to doing something more invasive. So we definitely go for a non-invasive option. And then other patients kind of want that one and done, not opposed to having a surgical approach. And that may be the best approach for them. It really will depend on, again, long-term result, but also their time commitment. We do have some non-invasive body contouring that requires a weekly commitment for 6 weeks. And then we have others that's kind of a one and done, that's non-invasive. And then of course, the Body Tight, which is the radiofrequency wand and liposuction, that is a one-time treatment. The patient is not going under. So if that's their biggest concern, we do this all under topical lidocaine. So I have a large bag of IV fluids, we add lidocaine to it, and we use a process called tumescence. So we essentially protect all the vital organs, all the major blood vessels, and then we add fluid to the area. And then after the area is anesthetized and the area is tumesced, then we make a small incision and we're able to go into that area with a radiofrequency wand. Radiofrequency, we're able to tighten tissue and also dissolve fat. So the wand is placed internally into the fat layer of the skin, and then it also has an external probe. We're heating the skin up to 68 or 38 degrees, and that's something that's measured on our machine. This, like everything else, you want to go to a licensed professional. Physicians should only be performing this procedure. Legally, only a physician can perform Body Tight. Sometimes we have patients that have unwanted fat. Other times they have lost a significant amount of weight and they just have skin laxity. So there are procedures that work better on skin laxity. There are procedures that work better on fat removal primarily, and then you get the secondary effect of a skin tightening. It really will be based off of the patient's physical exam. I am not a plastic surgeon, so if a patient requires a surgical result like a tummy tuck or a skin revision, we would refer them to one of our local plastic surgeons.